When you're looking for KitchenAid innovation and quality, who has the answers, the selection, the price? Ventura TV Appliance. With billions in nationwide appliance buying power, more than Home Depot and Best Buy combined, will help you save. Our low prices on ENERGY STAR qualified KitchenAid appliances save you energy and money and pay no interest on select models when paid in full within 12 months. Ventura TV Appliance, serving you since 1951.
Hi, I'm John Mallis, and welcome to this live edition of Connect with Me here on the showroom floor at Ventura TV on this Thursday morning. Today, it's Ask an Expert. Who's the expert? You'll find out in just a moment. 436 MeTV option 11. Do not wade through the message. Remember, turn down the sound on your television set, or you might get all kinds of feedback, and then what's going to happen? Won't be able to take your call. Back in just a moment. And it is Ask an Expert Day here on Connect with Me on MeTV Fresno, live on Comcast Channel 187 and 43.6. And you're more than welcome to join the conversation today because we're talking about something very interesting. And I don't believe that we've had a surgeon, an actual surgeon here on the program that actually takes that scalpel, you know, and makes a cut somewhere on your body that needs to be cut, right? A surgeon, that's what a surgeon does. Have not had one of those here on the program, so you're welcome to call in at 436 MeTV option 11. You know, when you talk about surgery, there is a certain type of surgery that is necessary. There is life-saving surgery in many cases, but there is also the type of surgery that is, you know, it's elective, it's cosmetic surgery. Well, we're going to be talking about both today because we have an oral surgeon in the house, and she's very well qualified, been practicing for many, many years, and you are welcome to call in and ask a question. This is Ask an Expert, and 99.9% of the time, you ask better questions than your host. Let's go to the videotape. I'll show you exactly what I'm talking about. Take you out there to Northeast Fresno. You are looking at the outside of the building. It's called the Fresno Oral Maxillofacial Surgery and Dental Implant Center. If you need oral surgery, let's say dental implants, for example, then the surgeons on staff are board certified. They are trained, they are licensed for general anesthesia as well, so they can do the surgery, they can do it all right there in the same building. Not a problem. They don't specialize in just any one particular area, but they can take on just about anything, such as, my friends, trauma cases, reconstructive surgery, pathology, corrective jaw surgery, any types of fractures that you might have on the jaw area. However, I might add, dental implants seem to be the in thing to do with a lot of people these days. Dentures are old hat. Gone by the wayside with a lot of people, I might add. It's not cheap, though. We'll talk a little bit about the price today, but you're welcome to call in. There are 4 doctors on hand. We have one of them live in our studio right here, Dr. Shannon Barnhart. She joined the group back in May, hasn't been there long, but she's a graduate, University of Texas, and has been practicing dental work for about 11 and a half years, has been a surgeon for about 8 and a half years. She is, my friend, the expert. I, on the other hand, am not. So therefore, you are going to call in and ask Shannon a question, Dr. Shannon Barnhart, I might add, and ask her if you have any problems with your gums, you think you might need oral surgery, maybe a little facial reconstruction, or whatever the case may be. Call in, 436 MeTV, option 11. I am not the expert. Dr. Shannon Barnhart is. Back in just a moment.
Now, why don't you tell us the whole story right from the beginning? All right, from the beginning. This is the city, Los Angeles, California. My name's Friday. I carry a badge. Police officers.
You any idea who the other man was?
My partner's Bill Gannon.
Program?
We got just one big question.
Yeah.
When?
Now on MeTV Fresno, Xfinity 187.
We're back here with our program. It's Ask an Expert Day, and I love this part of the program when you can have an expert on and talk about anything you want, ask any question that you want, because, I mean, most of us here at Connect With Me are experts on very little, if nothing at all. And so I'm welcoming our I'm just trying to be humorous today. All right, Dr. Shannon Barnhart, you're
Yes.
here. How are you? An
Very
expert in dental work, right?
That's
and
correct.
facial reconstruction. And now, how is it that you chose this line of field? Because if
Right.
I were to try to do it, I would freak out at the first sight of blood.
Oh, wow. Well, you're not alone, but I, on the other hand, enjoy surgery and all that comes with that. So,
Yeah.
right, I've always been in the mindset of helping others, and became a dentist and then an oral maxillofacial surgeon, all
Yeah.
with the goal of helping people surgically.
Yeah. Now, you had to go to medical school, did you? Or explain that.
Right, and so of course there's undergraduate, there's dental school. All oral and maxillofacial surgeons must be dentist first, and that's a 4-year program. And then oral and maxillofacial surgery is its own residency, and that is 4 to 6 years to do that as
Wow.
well.
So you're talking, you could be going to school there for a better part of 8 to 10 years.
That's
just
very
to
true.
do what
12.
you're doing now.
Right.
Complex.
Very
costly,
complex.
right? Because it's not cheap to go to medical school either.
Right, no, it's not.
Hey,
You're
we have a
absolutely
phone
correct.
call already.
Oh,
Maybe we
okay.
have somebody that is in need, and you can ask or answer the question. Good morning. You're on with Dr. Barnhart. What's your question, please?
I wanted to find out if she can give us any info on the extended damage that takes place from the use of methamphetamine. Now, that's an ugly word, but
Oh.
I'd like to know a little more about it.
Interesting.
Yeah, interesting. I never even would have thought of that question.
Well, and that is a good question. Patients, we do see quite a few patients that have had problems either in the past or currently with methamphetamine, and it does.
Is it fixable?
Right, it does destroy a good portion of the dentition of the teeth, and often beyond repair.
What does it destroy? Does it destroy the gum, the
tooth-
tissue, the
tooth-
nerves?
the
what?
tooth itself erodes the teeth itself. So
Really?
right, and so what happens is often the teeth will need to be extracted and replaced, whether with a prosthesis or implants.
What does it do to the gum area or the nerves down in there? Does it destroy them too?
Well, it's painful when the condition has progressed to the point where the nerves are involved. So that definitely can be painful. So it does require often extensive removal of teeth and
Yeah.
reconstructing them at that point.
Yeah. Do you see a lot of those types of patients?
You know,
Or
I wish we
some,
saw
or
less,
some.
but we do see some, and it
Meth
is
users, huh?
yeah.
Or former meth
Yes,
users, yeah,
both.
that have
Mhm.
had
Unfortunately,
their teeth destroyed to a certain extent. And is
Right.
it a long process? Does it take weeks, maybe months, to kind of reconstruct that area after you've abused your body? Basically, essentially, is what goes on when you
Right,
use
well,
meth.
right. Well, the surgery, obviously, there's recovery, which is usually a week or more of recovery from, say,
Yeah.
the extractions or the actual surgical procedure. But then, if they choose to do more advanced reconstruction, implant-supported prosthesis or whatnot, of course, that can take longer to complete that full treatment. So it depends on if they, say, want dentures or more complex treatment to restore.
I have another question for you, but I better take this call first. A lot of calls today, maybe. Hey,
Okay.
you never know.
Right, sure.
All right, feel at ease. No problem here. Good morning. You're on with the doctor. How are you? And what's your question, please?
My question is that I'm diabetic.
Okay.
Okay, I'm diabetic. I lost all my teeth from the back, top and bottom, way at the back, and my gums. And I just want to know that being diabetic, would that make me lose my teeth? And how can I get, the teeth done? How would I fix up my teeth instead of doing dentures and all that?
Right. So diabetes is a complex disease that affects many systems, many body systems. It makes patients more prone to infection, and so sometimes we'll see large abscesses in the face and neck with patients that have progressed dental disease who are diabetic. There's also correlation with periodontal disease, which is bone loss and gum disease around teeth, and so it's common
That's
for patients.
caused by diabetes?
It's associated with.
Okay.
Right. And so it's, in other words, we see patients often that are diabetic that have advanced problems, oral problems.
Do you
disease.
have to give them any special type of medication before any kind of surgery or anything? Or?
No, often after surgery, antibiotics to help decrease the chance for infection if it's a pretty involved surgery.
Why are they more prone to infection? Because of the diabetes?
High blood sugar does affect the ability of the white blood cell to fight disease, and white blood cells, our immune system is what fights disease.
Okay.
And so having high blood sugar does affect that ability.
Yeah. Have you ever looked at a patient or observed a patient that has come in, or a potential patient, and you simply have to turn them away? You can't help them? Or very few?
Not a lot comes to mind.
Okay.
Fortunately, we are able to help
Most
patients. Absolutely.
Okay, explain what. Yeah, go ahead. No, I'm sorry.
So
Go ahead,
sometimes
doctor.
patients need to be, depending on the situation. My partners and I, and we're accredited, board certified oral maxillofacial surgeons, but we do operate at the hospital, and so some patients need, care in the hospital. Most can receive care in the clinic, in our actual outpatient
you're trained
surgery
and
center.
licensed in that area, so that's not a problem. You do everything in the building there.
Right.
By the way, before we go any further here, Dr. Barnhart, mention your partners. We got to give them a little bit of credit too, right? Go ahead.
Yes, and my staff.
Your staff.
Our staff.
Too.
So Dr. Gerald Alexander has been with the practice for over 30 years, and
he started the practice, or
he was one of the few. There's actually Dr. Anderson who started the practice in the 60s, but Dr. Alexander's been, as I mentioned, with the practice for 30 plus years. Yeah. And there have been several partners that have transitioned through the years since the practice has been.
Is one of
and
them.
Dr. Alan Chen is also a current partner, as well as Dr. Arda Van Kradper. And we have a wonderful staff as well.
Right. Now, Alan's been there about 4 years, Artavan 6, and you started there in May. What brought you here? University of Texas grad. You must hate the Oklahoma Sooners, huh?
I'm not a big fan of Oklahoma football, no.
Now, what brought you here?
Family, my husband and stepdaughter.
Now, your husband's a firefighter, right?
Yes.
For the city of Fresno.
He is.
Well, that's good. That's good. So, I want to go to the first videotape before we go to commercial. Let's roll it, and you can describe in your office there. It's in Northeast Fresno, kind of borders Clovis and Fresno. What's going on here, Dr. Barnhart?
This is Dr. Chen, who's taking a real live X-ray of, it's a dental X-ray that we use to verify implant success. This patient's previously had an implant placed, but the bone can be better visualized on the X-ray. This is a digital X-ray, and so there's a digital sensor, and that allows us to bring it up onto the computer and visualize the anatomical structures.
So is that a live picture of inside of what's going on in her mouth right now on that screen?
Absolutely.
It's a live photo.
It was just
picture.
You saw it being taken there a second ago.
Yeah.
And and when I mentioned real time, it's on the screen right away.
It's like a live
within a second.
picture. Yeah.
All right. Seconds.
And go ahead.
Oh, and right now he's just using what's called a torque wrench to basically test the stability of the implant that, as I mentioned, had previously been placed. It's a check to make sure that the bone has integrated onto the surfaces of the implant and that it will resist any kind of rotation and is considered a stable implant ready to have a tooth put on it by the dentist.
This is an X-ray here?
Yes.
Okay. Now, if somebody is having an implant, what kind of questions, what kind of concerns do you have for those folks that want an implant?
Well, obviously, a lot of patients are referred from their general dentist who has already kind of discussed with them the treatment options available for implants and replacing teeth. And we just want to find out what their overall goal or aim of surgery would be, whether or not we can meet that, how we're going to best meet that.
Some want to improve their smile maybe, or just remove a tooth because it doesn't look good, or what?
Well, we wanted to remove teeth, with a dental diagnosis, to do so. There are cosmetic procedures to make them look better if they're still viable, healthy teeth. So, obviously to do an exam to determine if, say, an extraction is what they need. But having come from a general dentist, if it's something that requires surgery, then they'll come see us.
Yeah. Okay. We're talking with Dr. Shannon Barnhart, and she is an oral surgeon, has been for many years, an expert in the field. Your phone calls are welcome here at 436 MeTV option 11. Turn down the sound on your TV set. Got more to talk about here. A lot of time left. We're back in just a moment.
When you like Ventura TV Appliance on Facebook, it's nice. But when you love the Samsung big screen we deliver, it's even better. Our website is cool, and it's a good place to start. But you really should touch the merchandise before you buy. Time for that upgrade to an HD 3D web-enabled Samsung TV. Get the best selection, price, and service in town without waiting. Come in to Ventura TV Appliance and touch the merchandise today.
Back here on the program on this Thursday morning, and we're talking to an oral surgeon, and we do have a telephone call coming in, and today is Ask an Expert Day. And as you can tell, I am not the expert, but we do have a phone call, and what's your question, please, for the doctor? Go ahead.
Hello?
Yeah, hello, you're on
Hi.
the air, go ahead.
Oh, thank you. So I have a front tooth that I was in a car accident some years ago, and it's turning dark, and I've had a root canal on it, but I'd really like to have an implant, and I'm just wondering how I go about that, and how do I know if I'm a candidate to even have an implant?
Well, that's a good question. Most patients are good candidates for dental implants. Implants are made of titanium, so if you had any allergy, severe allergy to titanium, you would not be a candidate. But implants are a good means to replace teeth, especially front teeth.
How do you know if you're allergic to titanium? How would you find that out?
Right, it's very rare, first of all. And some people have had exposure. Titanium is used in reconstructive bone plates, if you've had a broken,
So that's what
femur.
the implants are made of, huh?
Mm-hmm.
Titanium.
Titanium. So,
Really?
but and again, it's very rare, but that would be
Right.
something that would be, not compatible. But patients, as I mentioned, they can speak with their general dentist to determine if there are other options to address their concerns with a
Yeah.
particular tooth. But if the tooth needs to be extracted, then we would meet with that patient and go over x-rays and consultation to determine.
But it seemed like her tooth, from what she said, is like turning color. It's turning dark in
Sometimes
color.
that can happen with trauma. That actually the tooth does turn colors. There are things to kind of camouflage that color change if it's already had a root canal done that are non-surgical. But if the tooth, as I mentioned, needs to be extracted, then it could certainly be replaced with an implant.
What else can destroy your teeth besides obviously the use of drugs like methamphetamine? Regular smoking? Can regular smoking ruin your teeth?
Well, it can certainly discolor your teeth. It's also heavily associated with periodontal disease, which is bone loss and gum disease. And eventually, with periodontal disease, severe disease will lead to loss of the teeth. And
Eating certain foods ruin your teeth?
Yes, there are foods that are acidic.
Such as?
Well, certain fruits and things, citric acid type, and drinks that contain a high amount of acid can chemically erode the teeth.
Yeah. Okay, we do have another piece of videotape. We do want to roll it here. And I want to mention your business one more time. It's the Fresno Oral Maxillofacial Surgery and Dental Implant Center, located at where?
It's at Herndon and Maple, 7025 North Maple.
Pretty close to Clovis there, but it's actually Fresno.
Fresno, actually.
Yeah, all right.
Fresno.
What's going on here?
Well, I'm just discussing with the patient who has a non-restorable tooth. In other words, the tooth needs to be extracted through decay and different dental disease. The patient,
Looks like the lower.
well, this is a
gums,
model of the lower teeth, and she is apprehensive about losing a tooth, not sure how she wants to replace the tooth. She does have teeth on either side and was asking about options. There's something called a bridge, and that does rely on teeth for teeth on either side for support of that false tooth. And then there's also dental implants, which we've talked about. They're titanium posts, if you will, that are integrated into the bone. The fancy doctor term is endosteal. Mm-hmm. And that's what we're describing to her as an option.
Oh, okay. Did she feel comfortable in the chair there? Or
Absolutely.
She
chose
did?
IV anesthesia for her extraction.
So she went under
surgery.
and she had it done.
She did, absolutely.
Another call here. Good morning. You're on with the doctor. Your question, please, quickly.
Yeah, does dental work come with guarantee or warranty? I'm talking even the stuff done at a general dentist office.
I'm not exactly sure what what he's referring to there.
Well, if you have an implant, is it guaranteed for 6 months or a year or 2 years? Like
there's no written
warranty. Is there a warranty that comes with it?
There's no written warranty. We do take care of our patients in terms of if there are extenuating circumstances or concerns that we may have, but there's no formal warranty process with what we do. But again, we stand by our patients and take care of them as needed.
I said in the monologue that, and I was kind of saying it facetiously, and that is that dentures are kind of the thing of the past. Are they? Is that a factual statement, or is this just fiction in a way?
Well,
is that old hat?
So dentures are prostheses that do replace teeth, and people still
still use them.
They're still being used by patients as a way to replace their dentition.
Is it correct to say not as much as the dental implants?
Well, dental implants are a very popular choice. As not only are they popular for reasons that they don't come in and out of the mouth. Most patients don't like the idea of their prosthetic or replacement tooth coming in and out, and so it avoids that need to come in and out. It also is less bulky, but there are such things as implant-supported dentures and implant-supported prostheses that don't come in and out of the mouth, and that patients don't equate with traditional dentures, I should say. So there are improvements on that.
They don't like what they look like once they take the dentures out either. It's not a very nice looking cosmetic thing.
Right. Well, the dentures actually give support to the lips and cheeks, and without the dentures, if you're lacking that support, patients do not usually like the way that their face looks without that support.
If somebody came into your office, doctor, and said, I don't know what to do. I don't know if I should get the implants or use the dentures. What would your recommendation be?
Right, and so it's every patient is different, but there are lots of new technology along with dental implants that can take care of some of the concerns that patients have regarding traditional dentures. And so again, kind of figure out where they're at, what their desires are, how we can best help them in that process.
So you have to evaluate each individual. Each case is different, not one size fits all. The implants last how long? Can they last you a lifetime?
They can last you a lifetime.
They can. So if
it requires the bone to maintain itself. The bone is the anchor for the bone is integrated into the implant, and so the bone is essential for health and stability of the implant. But unlike teeth, implants do not get cavities, and so
you can't get a cavity.
Not on titanium.
Do they put a crown on there?
They do put a crown on the titanium implant, and the crown itself is cemented to the abutment, which is a metal component. So there's no tooth structure there for Streptococcus mutans to.
So there's no way for the titanium to decay or anything else. Okay, all right. And what's the crown made of?
So their crowns can be made of all different materials. Often people choose porcelain, which is a tooth-colored option.
Yeah.
So porcelain is an option. Other materials like gold and porcelain and metal crowns. But the general dentist is a go-to person with regards to placement of the crown, and other dental specialists place crowns on teeth. There
are a few things in life I couldn't do. I couldn't be a doctor or a dentist. I don't like the sight of blood. I couldn't be a fireman. Scared of fire.
Most people are.
A lot of things I wouldn't want to do, even if I could do it. Anyway. But I'm glad there is somebody who does do it and does it well, like you.
Thank you.
All right, we're going to continue our conversation here on Connect with Me. I am not the expert, but we have one in the house, 436 MeTV option 11. Back in just a moment.
This black and white patrol car has an overhead valve V8 engine. It develops 325 horsepower at 4,800 RPMs. It accelerates from 0 to 60 in 7 seconds. It has a top speed of 120 miles an hour. The automobile has 2 shotgun racks, one attached to the bottom portion of the front seat, one in the vehicle trunk.
You want me to drive?
Now on MeTV Fresno, Xfinity 187.
Talking here with Dr. Shannon Barnhart. She is an oral surgeon. Now the call coming in. Good morning. You're on with the doctor. Your question quickly, please. We're running out of time. Hello?
Pardon me?
Yeah, you're on the air. Go ahead, quickly.
Great. I'm just curious if the doctor could give a price indication of what per tooth it costs for implants, and if she's familiar with victims of violent crime.
As far as the cost factor, and obviously that's a concern for patients, a couple thousand.
It's different for everybody, right?
Absolutely.
Okay.
So without, knowing the exact particulars of the patient's needs.
On average, let's say.
So a couple thousand for an implant, and that is for the surgical portion of the implant itself. There are fees associated with teeth going on the implants or the prosthetic being placed on top of the implant.
Right.
So it's a two-part process, if you will, and so those are separate fees.
And
as
you're
well.
paying for anesthesia and other
And those
things
are
that go
separate
with it.
fees.
What about insurance? Will insurance cover some of that stuff, or is every insurance company kind of different in a way?
Yes, to some extent, and we have financial coordinators and insurance coordinators that do look into that, and they would be the experts on that. But
Yeah.
there is a portion that is covered by insurance, and typically, say the tooth extraction and or anesthesia, things like that. And some implants are covered by insurances, so I can't speak to all of them.
Yeah,
by
you
any
just have to
means.
check with your insurance carrier
And our
check
staff
with
as
your
well.
staff.
Mhm.
Your staff will be able to tell. Okay, I want to get into the last piece of videotape here. It's a patient here who's going through some type of surgery. We're looking at x-rays, is that correct?
Correct. This is a panogram, which it just shows literally from jaw joint to jaw joint, the dentition, and it allows us with the red marks to describe, the risk, benefits, complications, and alternatives that may be associated with the surgery. In this case, just discussing with the patient prior to surgery what to expect.
Right. Let me ask you a question, too, as we're looking at this video here. We'll stay with us until the very bitter end. You also do reconstructive face surgery, which we all know what that is. But does that include, like, trauma if somebody's been in an accident? Or if somebody
Absolutely.
wants to just have cosmetic reconstructive surgery, do you do both?
So trauma involves, fractures
Right.
of the facial complex, and we absolutely do treat those. Often that requires incisions with hardware placement. Once the bones are reduced, they're fixated in the correct position. There are cosmetic aspects to what we do for sure. When the skeleton doesn't develop correctly, we actually cut. People think of it as breaking the jaw, but we actually cut the jaw and move it into its correct location, which can have
Wow.
significant cosmetic implications for patients.
And here you're actually performing the oral surgery, right? The patient
Correct.
is under
Mhm.
anesthesia?
They are under intravenous anesthesia, yes.
Yeah. And are you doing the surgery here?
Yes, this is a clip.
Yeah, interesting. So getting back to your statement about you actually break the jaw just to put it back in the right place.
And that's, again, for patients that the skeleton needs to be corrected. So there's only so much correction at the tooth level that can be accomplished. In some patients, they need more correction of the skeleton.
Talk a little bit about, because we only got a couple of minutes left, you also do joint surgery. You also are involved in removing parts of the face and reconstructing them, and we already talked about the dental implants, but talk a little bit about what other procedures you do besides those dental implants.
Right. A lot of people don't realize that patients that are born with clefts, have sometimes their bone has a cleft in it as well,
Yeah.
and we can reconstruct those defects. There are patients who need surgical procedures associated with orthodontics, which we take care of those as well. And pathology, there can be diseases of the maxillofacial complex that need to be surgically addressed, which we handle those as well. I mentioned infections that can be pretty
How do you
life-threatening.
find out if there's an infection?
Well, some are obvious. Some, the neck or the cheeks and below the eyes are
Is it
swollen.
visible or?
Right, and so a lot of those ones that we get referred are significant to the point where it's the patient's visibly swollen, and it can often be related to intraoral disease processes. And so
Yeah.
sometimes they need to be drained, incised and drained, and so those infections can be pretty
Okay.
significant.
Okay. What do you want people to know about your business? You've got 4 surgeons on hand, including yourself.
We do. Mm-hmm.
What's the one thing you want people to take away from this interview?
Well, we have. I love the practice that I've joined in May. There's a great group of surgeons, great staff. They're outstanding, and we're out to take care of the patients and do the best.
You love your work, I could tell.
I do. I do, and
That's
just
good.
that we're here
That's good,
for
though.
patients.
Yeah.
Certainly. Through
Yeah.
the whole step, before, during, and after surgery.
Okay, one more time. Let's give the phone number. How can they reach you, if reach your office, reach your staff, if they want to make an appointment?
That's at 559-226-2722.
Okay, and the address one more time?
7905 North Maple Avenue, Suite 108 in Fresno.
Okay, we appreciate you coming on. Next time you come on, you'll have to bring Alan Chen with you, your partner there. You can both come on. I'm sure that he'd be a good guest as well.
Absolutely.
You were terrific today.
Well,
Thank you
thank
for
you so much,
answering
John.
all the questions.
Okay.
I appreciate it. Thank you
All
for
right.
being honest. All right.
Okay.
Dr. Shannon Barnhart, and she was our guest today. Ask the Expert. She was an oral surgeon, and just go out there and check her out if you need surgery or if you need any kind of reconstructive surgery or implants or whatever the case may be. We're back with another program, another edition of Connect with Me on MeTV Fresno. Tomorrow, we've got the one and only Victor Davis Hanson here in the studio as our guest. Back with more tomorrow. Have a great one.